Nursing informatics is often misunderstood as paperwork, computers, and screen time that pulls nurses away from patients. Many nurses associate it with extra clicks, complex systems, and frustration rather than better care. This misunderstanding hides the real purpose of informatics in nursing practice. Welcome to the Learning Studio, where we don't just teach theory, we show how knowledge turns into real-world understanding. In reality, nursing informatics exists to connect patient care, data, and decision-making. It ensures that the right information reaches the right person at the right time. Informatics does not replace nursing judgment. It supports it by organizing information so nurses can act safely and efficiently. Think of nursing informatics like a well-organized handover. When information is clear, structured, and complete, the next nurse can act confidently. When information is scattered or missing, mistakes happen. Informatics systems aim to create that clarity on a larger scale. At the bedside, nurses interact with informatics constantly. Electronic health records track vital signs, medications, assessments, and documentation. Clinical decision tools flag risks. Dashboards summarize patient status. Nurses use this information to prioritize care, communicate with the team, and monitor changes over time. Understanding informatics also means understanding responsibility. Nurses are accountable for accurate documentation, timely charting, and verifying data. Incorrect or delayed entries can lead to missed warnings, medication errors, or poor communication. Informatics makes nursing actions visible across the healthcare system. In real healthcare environments, informatics improves continuity of care. Information follows the patient from admission to discharge and beyond. This reduces duplication, supports evidence-based practice, and improves coordination between departments and care settings. The NClex reflects this reality by testing professional accountability, documentation standards, and patient safety. Questions may involve electronic records, communication errors, or system-based risks. The focus is not on software skills, but on safe and ethical use of information. Nurses who understand informatics work more effectively within complex systems. They recognize patterns in data, question inconsistencies, and advocate for system improvements when workflows create risk. Informatics becomes a tool for patient safety rather than a source of stress. Nursing informatics also shapes the future of the profession. Nurses contribute to system design, policy development, and quality improvement initiatives. Their clinical insight ensures that technology supports care rather than complicating it. Informatics is not about screens replacing care. It is about information supporting care. Nurses remain the decision makers, interpreters, and advocates for patients in a data-driven environment. Now that you understand how nursing informatics connects data to clinical action, the next step is exploring how nurses use analytics and outcome tracking to improve care quality and patient safety. That deeper use of data brings nursing into the future, and that's exactly where we'll go next here at the Learning Studio.